The EXTREME study was a study in patients with head and neck cancers. That is typically a squamous cell cancer. And these patients were patients with very advanced disease or metastatic disease. So these patients were then treated with systemic therapy. And the systemic therapy were typical chemotherapy drugs like platinum drugs and a drug called 5-FU. And in order to improve on this type of chemotherapy, patients were randomized to receive additionally the monoclonal antibody Erbitux, cetuximab, which is an antibody that directly targets the receptor for a specific growth factor for those squamous cells. This study has now become a reference, or this study has created a new reference regimen for the treatment of patients at least with metastatic disease in the first-line setting, which is combining the chemotherapy with the biologically targeted agent Erbitux. In a positive experience because we have seen a lot of patients with dramatic responses, and response doesn't just mean a tumor gets a little bit smaller, but these were mostly patients where the tumor was rapidly growing. This disease, very frequently, a tumor can double in size within a few weeks. So there were patients who had like tumors as big as the fist appear, and that during the therapy with this combination melted in very few weeks. And then this was, of course, for the patients not just a gain in lifetime, it was also a gain in life quality.